Well, during a storm like this, as you can imagine, if you're working in a hospital, you face a unique set of challenges. NBC News medical correspondent Dr. Torres is in Miami with some of those stories. And Dr. Torres, good morning. I know you were embedded in one of Miami's biggest hospitals. How was that? How was the day and the night handling that situation?
Yeah, it was very interesting. It's Baptist Hospital of Miami, which also has Baptist Children's Hospital inside of it. And when you first walk in there, it's one of those almost surreal sights that you see where people are just lining the hallways on air mattresses. And we're talking hundreds and hundreds of people. And what they have done is, well, for one, the people they had that are already in the hospital that couldn't leave, they have generators and backup generators to the generators to make sure they have power to sustain the electronic equipment that they have there. But on top of that, they also brought in 100+ pregnant women. These are women who were 36 weeks pregnant or more or had high-risk pregnancies to make sure they could ride out the storm in a place where they could get medical care if they need it. And then, of course, the staff. We're talking to doctors and nurses. All the staff stayed as well, even though their own homes were under siege here and having their own problems. They stayed there willingly to make sure that these patients were taken care of.
Doctor, I would imagine a lot of people knocked on the door of that hospital. Was everyone allowed to come in, or were there certain people who simply had to be turned away to other shelters?
And Matt, that's a great question. That's one we asked them directly. And what they said were, number one, ambulances stop running when the winds get to a certain level. So the ambulances were not bringing people, but the ER was functioning as normally. They said if people knocked on the door, they didn't turn anybody away. They even talked about a woman, a 9-year-old woman that came up to the door, and just basically the ambulances brought her there because there was nowhere else to take her. And they said, sure, come on in, we'll find room for you. And they did. And again, when you walk down the hallways, air mattresses everywhere, families everywhere, because they came along with the moms-to-be as well. It was just one of those situations where they did what they could to take care of all these people, and they did a fantastic job.
But doctor, the flip side of that is some hospitals had to evacuate, and I can't even begin to fathom how difficult a process that must have been.
And evacuation of a hospital is always one of those things that, it turns into almost a nail-biting situation when you think about how it's going to happen. But hospitals practice that time and time again. And what they do is the patients that are ambulatory, those that can walk on their own or walk with some assistance, they get out of there with minimal assistance. But the ones in the intensive care units, the ones that just came out of surgery, those are the ones they have to move very delicately. And they take those one by one and move them, making sure they get to a facility where they get equal care. And so that's the trick there. And they'll do that very carefully. Sometimes they can do it over a longer period of time. Sometimes they have to do it very quickly. When they do it quickly, they're very thankful. They've practiced this in the past because it's one of those things that you can imagine can turn chaotic extremely fast.
We talk a lot about police officers and fire officials and rescuers all the time. We don't often spend enough time talking about the nurses and the doctors who staff these hospitals during times like this, and our hats off to them.
Absolutely. Dr. Torres, thank you.